So they were talking about the membranes, and he was placing the membrane, right?
Yeah.
So at the office where she places implants and does membranes, I thought for sure she was saying that you're supposed to put the rough surface of the membrane. I thought that goes like towards the occlusal, meaning like it would be away from the bone. But today he said you always are supposed to have that rough surface toward the bone.
That's a good
I mean, it's probably something that's really small, but
I always get that mixed up myself. I'll research it and I'll let you know.
And I asked him again just to make sure I heard it right, and he said, yeah, it's always towards the bone. I'm like, I thought she said something else, but I'm going to ask her just to be sure. Yeah. But I'm like, well, shit, I don't know which way to go now.
No, I'll find out and let you know. Okay?
Mm-hmm.
Alright, so here you are.
But so far, you're thinking like this is not that great of a course?
No, I didn't say that, and I won't say it because I didn't take it. What I will say...
I mean, I know, but you're kind of like,
No. Okay, so what that reservation that you hear there is more so based upon the fact that when you take these 1 to 2 day courses and you don't follow somebody through, what ends up happening is there's gaps in your learning. So...
But how though? This is a longer course, and we're going to be working with the patients. We're going to be placing the implants. We're going to be restoring them too, and we'll be able to follow the patients for some time. So, what do you mean about a gap?
Okay, so let me say this: there's a possibility of a gap because right now you don't know what you don't know.
Well, true, but I'm still at the beginning.
Well, you are still at the beginning. However, I've placed, I don't even know how many implants I've placed at this juncture, and I still don't, I'm still learning.
Right.
So, that's why I say,
too.
Huh?
I said things change too,
and things change too, and so, with that being stated, when you take these courses, I say it's always best to just do stuff first. I mean, of course, you didn't place any. But I say it's always best to do them and then take the course, or continue taking the courses so you continue to learn, because you could get up to placing 3,000 implants and still be learning something new on the 3,000 times. So it's not that I am saying courses are bad. No, what I am saying is don't think that by taking a course you're gold. If it's a 2-year, 3-year, whatever year, because even when you were in dental school and you did all your class 2s or class 1s, you're still gonna have to. There's always, do I etch the whole entire? Do I just etch the enamel, or do I etch the dentin as well? How long do I put on it for? So, and there's all these different schools of thought. So that's what I wanted to highlight there. That make sense?
Yeah.
So I'm not against it. I just say, it's not going to be your saving grace. So, the question about how to purchase an implant. The best way to purchase an implant is this. Finding a rep. Finding somebody who places a lot of implants, number 1. Number 2, the next step is to find a rep. Their rep, whoever their rep is. And generally, the rep is what makes or breaks the implant experience. Most all companies that are reputable, if you pay at least $250 plus $300 range, you're going to get a reputable implant.
Why does the rep make a difference? Just because you can have somebody there if things start to go awry,
Yes,
that's why.
Yeah, because the thing is, if you play, there's so many parts and pieces depending on the system that you choose. There could be 12 parts for your procedure. There's different torquing values. There's different instruments. There are different torque drivers. There's different. Is it a torque handle, or is it just a torque? Is this just a hex driver? Is this a conical abutment, or is this non-conical abutment? Is this a hexed, non-hexed? Is this for single tooth case, multi-tooth case? Do I want, if I want to do an overdenture, GPS versus ball, non-ball. There's so many different things, and depending on what you're actually using, am I going to do, what is another one? Mini implant, non-mini implant. If I want to place a 3 millimeter implant, can I use it with my regular kit, or do I need to purchase a whole nother kit just for this, just to place a small implant versus a 7 millimeter implant, or 8 millimeter implant, or 10 millimeter implant, or a 4 millimeter implant? Is my kit gonna come with a surgical? I mean a hex. I mean not a hex, but is my kit gonna come with a restorative torque driver, or is it gonna come with a surgical torque driver? And we haven't even started talking about placing implants yet.
Right.
And then the picture that you sent me with Nobel, which had 3 specific types of implants. The top one being for immediates, the middle one being for all 4 types of procedures, and the one at the bottom being for like your everyday workhorse type of implant placement when it's a healed site. Those are certain things that you need to be aware of. And then if you look at it, each surgical kit, is it just a surgical kit or is it a restorative kit? Is it both? Do I have to order more? And so as you can see, it could get really, really, really complicated. And so when you have a rep, you want to make sure, like for instance, Keystone, Nobel, I mean not Nobel, but BioHorizons, they have these kits where it's a restorative kit where you have the impression coping, you have the implant analog, and you have like this little piece that you stick on top of it. And when you flow the material in and make your impression, what size do you actually go with? Because of tissue height. You follow me or you know? Lost.
Yeah.
You are following me?
I hope you didn't expect me to answer that.
So for instance, there's so this is what you're going to end up generally buying when you purchase an implant. You want to know the price of the implant. You want to know, does the implant come with a cover screw? Does it come with a healing abutment? So like Implant Direct, they have a cover screw and a healing abutment all mixed in one. However, certain implant companies will just provide you with this implant solely, while some implant companies will apply you with the implant and the cover screw. And so the implant is basically what you put in bone. The cover screw is what you place over the implant so the tissues will heal over it.
Yeah.
The healing abutment is what you put on top of the implant if you want the tissues not to go over the top of it and form the space where the crown would actually come in and out of. And so if you were to place an implant, let's just say for your first case, I would recommend, and you get it torqued down to 35 Newton centimeters, what you would end up doing is I would recommend putting a cover screw on it, letting it sit for like 3 to 4 months, coming back and then putting the healing abutment on. That's considered a 2-stage.
Yep. So I do know those fundamentals.
Okay, so good. So now we're just talking about how to purchase an implant. Let's just say you got sexy with it and you're just like, you know what? I'm going to purchase an implant. I'm going to forego this 2-stage and I'm going to go to a single stage. Well, you'd want to make sure that your torque values are at least 35 to 45 Newton centimeters to put that healing abutment on there. So you don't even need the cover screw at this juncture. You follow me?
Yeah.
So with that being stated, now, you don't even need a cover screw for that juncture. And let's just say you purchased an implant and the cover screw and the healing abutment, and let's just say the cover screw is like $50 to $100. That's $100 that you would have saved. Follow me? Yes, no, maybe?
No, I think gotcha.
Okay, I didn't hear you. So You purchase an implant. Hopefully, it comes with a cover screw. Generally, they don't, so you're gonna have to purchase a healing abutment. Healing abutments run from anywhere from $45 up to $75, maybe $100, depending on if it's like your higher level implant companies like Nobel, BioHorizons, Zimmer. So if you were to just take that, if we're just going to do the surgery, you told me that you all charge roughly $1,800 for just a surgical placement. Was that still accurate?
I think that was inaccurate for the placement. At the school, you mean?
No, for at your office.
At the office for placement, I think. Oh, that office. But that in particular office, I'm not for certain, honestly.
Okay, so let's just say, make the even value. Let's just say it's $2,000.
Mm-hmm.
And you're getting ready to place your first implant. Let's just say you have all your surgical equipment. You have your blade, 15 blade, periosteal, Minnesota, gauze, Paradex, saline. You have the irrigation to run towards your implant drill. You have your implant surgical setup already there. You'd want to purchase an implant cover screw healing abutment. So let's just say your implant was $300. And let's just say that your implant came with did not come with a cover screw. I'll go off Nobel's. It didn't come with the cover screw. So it would be, let's just say the cover screws are $50 a piece. The healing abutments are $50 a piece. So right now, into this surgery, you would have spent $400. Follow me?
Yeah.
Implants $300, cover screw healing abutment $400 is total $50. Total would be $400. So right now you're dealing with a profit margin of $1,500. Make sense?
Yep.
No, take that back. If it were $2,000, no, just make it $1,800. If you were to subtract that $400, now you're sitting at $1,400 of a profit margin, disregarding staff, utilities, all that, X-rays, and all that other stuff. So 4 months later, after three or so post-ops, patient comes back. You're going to have to purchase a impression coping. You're going to have to purchase implant analog. And then you would probably want to purchase a stock abutment or a UCL abutment. So that's 3 items to get started, and at least 3 items, a fourth item if the stock abutment or the UCL abutment comes with or without a screw. 5 items, I'm sorry. So when you come to restore it, you would need an impression coping, an implant analog, a stock abutment or UCL abutment, a screw that will engage the UCL abutment or the stock abutment, and you would also need a lab screw, because if you send your prosthetic screw to the lab, they're going to torque it down, take it off, torque it down, take it off, and depending on the screw that you have, if it's a gold prosthetic screw, when you torque down a gold screw and you untorque it, it's ruined. And generally those screws will cost anywhere from $35 to $50 a pop just for the screw. So impression coping, let's just say $80, implant analog $20, UCLA to stock abutment maybe $150. Prosthetic screw $50. Plus, you would probably get some lab screws. Those lab screws are fairly inexpensive. It's probably like $10 a screw. You could probably get 10 of them for the price of $100. So you're looking at least 8 items in order for you to place an implant from start to finish and have a patient to the crown with the crown. And so another thing to also take in consideration, the cost to actually get the crown made. If it's a screw retain, I would say you're looking at about $300 per unit, just for the crown. Or if it were just a cement retained crown, you're looking at maybe $150 to $200, depending on the lab that you go to. So when you look at all the 8 items that you have to use, and if you go back to the healing abutment, because that tends to customize the actual surgical site. You have flares within the healing abutment. How tall is the tissue? You at least want to have the healing abutment 3 millimeters sticking out of the gums. So if the tissues are generally going to be about, let's just say tissues are like 2 millimeters, then you probably want to get a 5 millimeter height healing abutment, because that would be 2 minus 3 is 2 minus 5 minus 2 is 3 millimeters.
Yeah.
And then you also, huh?
No, I was talking to his dog. Sorry.
Am I losing you?
No.
Okay.
No.
And then you also want to take into consideration how wide the healing abutment is going to be. So if you put a 4 millimeter implant in, and let's just say you're going to be restoring a regular space, let's just say a premolar number 12, you probably want to go with like a 6 diameter healing abutment, so it puffs out those tissues, so you have a nice emergence profile coming out of the actual site. And so the reason why I say it's so important to have a good rep is because all those things that I went over with you can get very, very dicey. And if you're sitting down with the chair and you're like, okay, can I use this surgical kit to actually restore, or do I need to actually order an actual complete restorative kit? Because that's how these companies will get you.
I see. That makes sense. So what are your recommendations for an implant motor? Does that matter? Or not really?
Not necessarily, because, I mean, all you're going to do is, like, there's different motors. Like, they have, like, for instance, I'll go from the foot pedal. The foot pedal, there's certain foot pedals where you could increase, like you're driving a car, the more force you put on it, it will go fast. The revolutions will go faster.
Mm-hmm.
And sometimes that little foot pedal is corded or non-corded. And then you have some, they have an LED screen where it's touchless, and then there's some that you could operate from your cell phone. I don't think that's all that's necessary. I think just getting like a regular, if you're at one office, I would just get something to where you cover up with plastic. It really doesn't matter, the implant company, the implant motor. Some good implant motors I would recommend is like a W&H.
Say that again?
W&H.
W&H.
Yeah. You have some, that's the one I particularly use. I would definitely get the implant motor that you could change the sequences with your foot, so you don't have to go back and touching it. But I mean, because some people, they will torque their implants in with their implant motors. Some people like to use a hand torque driver and just torque them on in. So it really just depends on that. But I think the most important thing is the actual handpiece.
Okay.
Because that handpiece, I mean, if you look at it, you could really, I mean, if you really wanted to get like interesting, you could, I don't even know how I'm saying this, but you could literally get a slow speed handpiece on your rheostat and place an implant. I don't recommend it, but
yeah.
but those slow speed handpieces, you could adjust this how fast they go.
Yeah, it's true, but
So
I don't think I would want to do that.
I'm not saying that you would, but I just want to give you like the totalitarian goal, the full thing, because the thing is this: when you take the core and I don't know if you realize I'm going to give you way more detail probably than you ever thinking about, but I just want to throw it out there because if you have a well balanced, if you have I think that if you could see the whole picture opposed to just focusing on one thing, it'll allow you to self discover and see what route that you want to take.
Mm-hmm.
So I would definitely go with like a reputable like W&H handpiece. A B&Air motor is good as well. I would say if you're going to go in order of importance, I would say get a good implant, a good handpiece, and everything else is based on.
What suture material are you using?
I'm sorry?
What suture material are you using?
Suture material. Suture material. You could use. Majority of the time I use chromic, 3.0 chromic. If there's a case that I think.
Why did you laugh like that? Like that wasn't a legitimate question.
No, it's a legitimate question. I just haven't heard it asked that way. Suture material. Generally people say, what type of suture do you use? Suture material. So I use.
No, because there are different materials for the suture.
Yeah, I know. You have PTFEs, you have chromic, you have.
Right, exactly. And I didn't know if you were using that or if you were using chromic blood. Because the reason why I asked is because an oral surgeon and the director kind of alluded to the fact that you still can use it, yes, but as far as it being one of the weaker types of sutures, of course, chromic is better than plain gut, but chromic was like at the bottom of the list versus, of course, PTFE and a lot of the other ones that they told us about. I can't remember them all off the top of my head, but that's how I was asked. No,
good question. So once again, it boils down to what type of procedures are you actually doing? So, and, are you in this aesthetic zone? Huh?
I'm sorry. My dog, whenever I'm on the phone, he just acts a fool. But go ahead. Sorry about that.
Take your time. So, it depends on what type of procedures that you're doing. A majority of the cases that I place implants on, I use chromic, 3.0 chromic gut. I like 3.0 because it doesn't snap on me. Because, I like to tie a tight suture. I like one, I'll throw it. And what I'll do is, once I'm tying it up, I like to tie it. And I don't like it when I tie it and it rips on me. So I like 3.0 because it's nice and fat for me. But there's PTFEs. Those are ones that they won't wick, but they're like a non-resorbable membrane. You eventually have to take them out. And then you have purple. Can't think of the name of it. Vicryl. Vicryls. Those will last up to about 2 weeks. And so I like those because they'll end up dissolving and it takes a little bit longer of a time. But if you're doing like some GBR, I would definitely recommend, if you're going to stabilize the resorbable membrane, I would definitely go with like a chromic on the inside and then like a Vicryl or a PTFE to get primary closure. So it just depends. So I would say this. I will never condemn a certain way of doing something unless it's just egregious. What I will do is this. I definitely will say, what are the indications for it? Because if you know what you're using it for, then it'll guide you to what you should be using it to use. So it's like if I were to go off-roading, I wouldn't use a Honda Civic. And if I wanted to go fast on a speedway, I wouldn't say, let me get a Hummer. So if you look at it from that perspective, it depends on what are the indications. But I believe that with the cases that you're going to be doing, a 3.0 chromic gut is going to be great because the thing is that you also have to take in consideration the cost. Oftentimes when you take courses, people are wanting to throw at you a specific company that they're being paid for to give you. And that can be advantageous to those who are putting on the program, and non-advantageous, or it could be a disadvantage to those that are taking it, because if money is something that needs to be dealt with, then you have to take that in consideration. Because like I said, we're already sitting at $400 just to place this implant. And if you're not charging $1,800 and you're charging $12 to $15 just for placement, you're already looking at least $300 an hour for chair time. So let's just say it takes you 2 hours plus the $400. You're already looking at $600 to place this implant, plus the post-ops, which you'll be doing for free. So 2 hours, $600 already gone, plus the other 2 post-ops, not including the healing abutment, which is going to cost you another $50. So now we're looking at, $600 just for one procedure that took you 2 hours to do, and it's probably going to take you another, I would say, on a good day, about 3 hours to complete just the surgical phase. So 3 hours time, 3 times 300, you're looking at $900. So if you place the implant at 3 hours for chair time, so generally the average for chair time is about $300 a pop. So if you spend 3 hours for chair time to place a $1,800 implant that costs you $400, you're already looking at $1,000 to place it 8. So now you're looking at $800 as your profit margin if you place it at $1,800, and that's if you took that time. And you're looking at least 3 to 4 visits. Is this clear? Is this helpful? Yes, no, maybe?
Okay.
So
my last question.
Yep.
So I do a lot of scanning at one of the practices that I work at.
Good.
And there's been maybe like 2 cases that I actually used like one of those scan bodies and scanned an implant for the restorative aspect, because I have been restoring implants,
Yep.
even though I have been placing. How do you feel about scanning? And then wouldn't that cut down on my cost as far as not having to get like the coping? I mean, yeah, you gotta order the scan body, but now that I mention it, what about that? What's that? The encode abutment by remember that Bellatech or something like that? Where you don't even have to use, huh?
Yeah, I was thinking. Yeah, I think that is because I know 3i has one. Bella maybe
Encode abutment or something like that through them. Yeah.
Yeah, it's either 3i or
I just scanned one last week or the week before, and I just inserted the crown. So I'm like, well, that's one less thing you have to do in order if you just place those types.
Yeah, absolutely. I mean, like I said, I don't know what type of practice you're coming into that you're going to inherit. But if you have that technology, absolutely take advantage of it. I'm looking at it from a perspective that you're brand new in the game. You don't have a CT scan. You don't have, a lot of this technology that some of the more, when you do something like that, like if you're doing a lot of ortho and you're scanning these things in, or you're doing a lot of CEREC crowns, and you're doing these digital scans, really big into digital dentistry, then there's put it like this: there's going to be cost regardless.
Well, yeah.
There's going to be a cost regardless. So, like I said, once again, I'm not going to say one thing's better than the other unless it's just egregious. No. But you're going to save, because the thing is this: what happens is you can do this. You could let's just say you didn't know that equipment, so it's already good that you know that you're familiar with that and you feel comfortable with it. If you didn't know it, then you'd have to learn it. And if you had to learn it, then just add all that on top of what you're doing. So if you're already good at doing it, I would even start looking at it like this. Let me look into design my own crowns.
Mm-hmm.
And then you can.
And don't get me wrong, like I've gotten spoiled at this particular practice, but I'm sure whenever I do branch out to have my own, if it's something I'm starting up, I'm not going to necessarily. I don't know what future holds, but I mean, I may have to buy all this stuff myself, and a scanner is going to.
Yeah, scanners could be at least 30,000.
Yeah.
I mean, So it just depends on who you go with and what your plan is. But like once again, I'm not going to crap on one thing to highlight another. I'm just going to give you a broad picture so that you could ultimately make the best decision. Because when you get into the courses, like I said, depending on if they're sponsored by like these bigger implant companies, they're going to push their product. And they're going to jam it down your throat. And you're going to end, and I would say a good 30% of the people out of that program are going to end up purchasing from them. When you purchase from somebody, you have to follow down the path that they tell you because you purchased what they decided to go with. And if it's all about the money, then you're going to have to spend a lot of money. And if money is an issue if money is a concern for you, then you're in now, because there's a couple things that you could do. You could be like, you know what, I'll go with them. I go with them. Well, what ends up happening is there's two things. Once you go with them, you have to continue staying with them. However, or you could be like, man, I don't feel like listening to anything else. I don't feel like I've had such a terrible experience with implants. Screw it, I don't want to do any of it. Then you have like $30,000 worth of equipment in your office that is just going to sit there that you have to pay for. So once again, it's like gain understanding, and that's why I don't have an issue going really, really down in the detail because I'm probably going to be the best person when it comes to detail because that's just how my mind operates. But I really want to give you a broad picture to kind of give you an idea of everything, give you a picture of the whole forest, opposed to just getting lost amongst your trees. So listen,
so you're saying that just because we're dealing with X system during this course doesn't mean that that's the system I should decide to buy on my own just because this is what I've learned.
Absolutely. Absolutely.
Okay.
Because each system, man, there's so many systems out there. Now they're starting to become all the same. But the system, like I said, all the systems are, if they're reputable, like I said, $250, $220 above, you're going to get a reputable implant. As you start getting a little higher in the fees, they're going to either, because you can't afford their implant, they're going to take away some of the items so you have to purchase them. So I'm just wanting to give you an idea of, hey, when you purchase an implant, make sure you know how much the implant is. Make sure you see if the cover screws are included. Check to see how much the healing abutments are. Number one. Number two, and I hope you're writing this down. Number two is when you get the surgical kit to place this implant, check to see if you're getting a restorative torque wrench. Because you could get a surgical wrench and it doesn't torque to 35 Newton centimeters, or it doesn't torque down to 15. It's like a regular wrench that you have.
Hold on, you said in the surgical kit, do you get a what?
A restorative torque driver. So if you wanted to put the crown on, if you wanted to put the crown on, can you do that with your surgical kit? Do you need other parts in order to restore the implant that you just placed? Or do I need to purchase something else? Once you have that out the way, then you need to ask the question of how much is an impression coping? How much is a analog? How much is a UCL abutment from a stock abutment? How much is a cover? How much is the prosthetic screw with the UCL abutment, or the stock abutment, and how much are lab screws. If you have all 8 of those items,
Yeah, you going too fast.
I'm recording it, so you're
I
good.
hit my phone. You said ask them about how much the impression coping is and how much the what?
Impression coping, number 1.
Uh-huh.
Number 2 is going to be the implant analog.
Oh, analog.
Number 3 is going to be the stock abutment or the UCLA abutment. Number 4 is going to be the prosthetic screw. How much is that? Because you need to have it just in case the lab loses it or you lose it from negligence or not paying attention, or your assistant drops it down the patient's throat, or it gets suctioned up on accident, or it drops and so small you can't find it. And then you need to have the lab screws so that you could take one out and send it off to the lab so they could torque it down in the event that they don't have that implant.
So what is it again that you said just now that you have to have 2 of so the lab can use one?
So you need to make sure you have a prosthetic screw. And a prosthetic screw is what you would place in the abutment to torque it down, or to place if it was a screw retained crown, you just take the prosthetic screw and it would be attached to the abutment and crown, so an implant supported crown, and you take that screw and you torque it all the way through, and it would end up seating your implant.
Why is this prosthetic screw new to me? Is that something that I just wouldn't necessarily deal with because I haven't been placing implants? Because when I send things out to the lab for a crown to be done for an implant, I've never had to deal with like making sure I had a second screw because when something comes back, it may be done.
Very good question. The question is, why haven't I not paid attention to this prosthetic screws even though I've been restoring implant crowns for so much time? Is because the lab will tack on a charge for a prosthetic screw. Once again, I'm gearing this information towards somebody who is for the first time starting to place implants. And there's not even the first time, but somebody who is semi-advanced into placing implants, and they're starting off on their own in terms of venturing into purchasing an implant for their practice and what things they need to think about when they're purchasing. And a prosthetic screw can cost anywhere from $45 to $50, maybe $80, depending on the system. And if you don't send the prosthetic screw according to the implant company that you have, how do you know that they're just not getting a random screw and putting it with your crown and you're torquing it down? So 3 years later down the road, your patient's like, man, this implant that you put in my mouth here is kind of loose. Mm-hmm. And when you go to try to get it out, it separates. Mm-hmm. Then you have to look like MacGyver to try to get that thing out if you're not experienced in taking it out. And you always want to get original equipment that's manufactured. Uh-huh. If you don't, there's these micromillimeters that can be off, and depending on the occlusal forces and the occlusal scheme that a patient has, taking into consideration the parafunctional habits if they have them. If you put something where it shouldn't be in the wrong environment and the patient has an issue and you're like, oh, I'll just fix this, and then the patient starts to see your confidence level drop 10% every 5 minutes, that's not a good place to be. Mm-hmm. So that's why I would look into supplying your own and just give the lab their own prosthetic screw, because the lab is not concerned with the patient. The lab is concerned with, they gave me something, let me get it out. They gave me something, let me get it out. They could care less. Very few labs really care about the patient. They're more so concerned with, is this look good? Will this work? in terms of from the model that you gave me. Your concern is the lab and what you put in that patient's mouth and how that patient looks and functions once they leave your office for 5, 10, 15, 20 years on. And so I'm giving you a broad spectrum of what it is in order to operate successfully and how to purchase implants and materials and how to select a company for an individual who has a semi-advanced experience with placing implants. And so, like I said, I really want to make sure that you have a broad spectrum of what you're actually doing so that when you ask specific questions, your self-discovery it'll be like, oh, this is what I'm doing? Okay, it makes a little more sense.
Mm-hmm. Good insight, Jared, as always. Good insight.
Like I said, this is a gift, and I've done this enough for many, 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 many people to learn from. So, like I said, I wanted to make sure that
you Dr. Fancy Pants.
I am Dr. Fancy Pants. Thank you.
Yeah.
No, but I really wanted to make sure that you were clear on this. Do you have any other questions about this stuff?
So far, no. I asked most of what my initial little inquiries were about. But I'm sure as I read more in this Mish book and go to lecture, I'll have others or a clinic or whatever, but I'm pretty sure I'll have more.
Cool.